Welcome to the deep dive. Today, we're tackling something a bit tricky, feline heartworm disease.
Yeah, it's definitely one people have questions about.
Exactly. You've probably heard loads about heartworm in dogs, but, well, what about cats? Turns out it's it's really a different ballgame.
Completely different.
We've gone through quite a bit of medical research, dug into the details, really, to pull out the most important stuff for you.
Yeah, the key takeaways.
Our mission today is simple. Cut through the heavy medical talk, give you the crucial information on the basics, how it actually shows up in cats,
Which can be subtle.
right? And how it's diagnosed, which isn't always easy. The real challenge is in treating it. And probably most importantly, prevention.
Prevention is definitely key here.
Okay, so let's get into it. The basics.
Okay, so the parasite itself, the actual worm, is the same one as in dogs. It's called Filaria immitis.
Same one. Okay.
But that's pretty much where the simple comparison ends.
Okay.
There's a really big difference right from the start.
Oh, yeah. What's that?
Microfilaria. Those are the baby worms, the larvae, that swim around in the bloodstream.
Right, the ones they look for in dogs.
Exactly. In dogs, you usually find them.
Yeah.
But in cats, it's rare. Like less than 20% of infected cats actually show microfilaria in their blood.
Less than 20%. Wow.
Yeah, and even when they do, it's often just, well, temporary. They don't hang around for long.
So straight away, it's not fitting the typical dog heartworm picture.
Not at all. And here's something that might surprise you. Cats usually get fewer worms, and the worms themselves are often smaller than in dogs.
Okay, that makes sense. Maybe less severe then.
You'd think so, but, well, recent studies are suggesting something interesting. Even though they're smaller, the lifespan of those worms in the cat, it might actually be pretty similar to how long they live in dogs.
Really? So even just one or two worms could be causing problems for years?
Potentially, yes. It means even a low worm burden isn't something we can just, dismiss.
That is surprising. Okay, so if it's less common to find the larvae, how common is the infection overall in cats?
Well, the good news there is that it is much less common than in dogs, especially unprotected dogs.
Okay.
If you look at the numbers, the prevalence in cats is roughly maybe only about 1/10 of what you'd find in dogs that aren't on preventatives.
1/10, so significantly lower risk overall.
Lower risk, yeah, and fewer adult worms on average when they do get infected. But again, fewer doesn't mean no problem.
Right, that lifespan thing. Now, who's more likely to get it? Are there specific cats, like certain breeds or ages?
The data doesn't really point fingers at any particular age group or breed. They all seem potentially susceptible.
Huh, okay.
But there is a kind of curious finding. Male cats seem to get infected more often in the wild.
Male cats. Any idea why?
And not entirely sure. They're also easier to infect in like lab settings. Could be behavioral, maybe they roam more, or maybe something physiological we don't quite know yet.
Interesting. Something to file away. So no specific breed, maybe a slight lean towards males. What about the big risk factors? What really bumps up a cat's chances?
The biggest one, and this probably isn't a huge shocker, is outdoor access.
Makes sense. Mosquitoes.
Exactly.
Yeah.
Cats that go outside, even just sometimes, their risk is about double compared to cats that live strictly indoors.
Double the risk just from going outside.
Yeah.
Okay.
And one thing to clear up, sometimes people wonder about other illnesses. Feline leukemia virus, ALV. That's not considered a risk factor for getting heartworm.
Good to know. So it really comes down to mosquito exposure, which means outdoors is the main risk amplifier.
Pretty much.
Okay, so let's say, worst case, a cat does get infected. What should owners be looking for? What are the signs?
This is where it gets tricky because the signs can be, well, all over the place. Sometimes really subtle, sometimes severe.
Not straightforward then.
Definitely not. Historically, we think of coughing with heart issues, right?
Yeah.
But with heartworms specifically causing heart failure in cats, coughing isn't actually that common as the main sign of failure itself.
Oh.
But, and this is fascinating, coughing often shows up early in the disease process, sometimes even before the worms are fully grown adults.
Early coughing, before the adult worms are even there. That seems counterintuitive.
It does, and it leads to this really, really important concept unique to cats. HARD, Heartworm-Associated Respiratory Disease.
HARD. Okay, what's that?
It means cats can develop breathing problems, lung issues, clinical signs
Yeah.
as early as 2 to 4 months after they get bitten by an infected mosquito.
2 to 4 months. That's fast.
It is, and here's the kicker. This can happen even if those worms never manage to grow into adults.
Wait, what? So the cat gets sick from worms that don't even survive to adulthood?
Exactly. It's the body's inflammatory reaction to the immature migrating worms causing damage in the lungs. That's a huge point. Many owners, even vets sometimes, might not realize the disease can manifest this way.
That completely changes how you think about exposure. So it's not just about adult worms setting up shop.
Precisely. So besides that early coughing, other signs can include dyspnea, that's difficulty breathing, labored breathing.
Okay.
Vomiting is another one, often kind of random, no clear cause.
Vomiting. Wouldn't immediately think heartworm.
I know, right? And then there's the really scary one, pulmonary thromboembolism, PTE. Basically, a blood clot lodging in the lung arteries.
Oh, wow.
Yeah, that can cause sudden, severe respiratory distress. It can be fatal, unfortunately.
That sounds terrifying.
It is. In cats that have had it for a while, those chronic cases, the vomiting and the breathing issues, tend to be the most common things you see.
Okay, so a range of signs, some quite serious. What about when the vet examines the cat? Anything specific they might find?
You know, often the physical exam can be surprisingly normal.
Really? Even with breathing problems?
Sometimes, yeah. Or the signs might be subtle. A vet listening carefully to the lungs with a stethoscope might pick up on increased bronchovesicular sounds. It's a specific lung sound suggesting inflammation or maybe fluid down there.
Okay, so maybe subtle lung sounds.
Possibly. But here's an important distinction. If the vet does find something, like an irregular heartbeat, an arrhythmia, or a heart murmur, or maybe a gallop rhythm, that usually points more towards a primary heart muscle disease, like cardiomyopathy. That needs to be considered too, maybe instead of, or maybe alongside, heartworm.
Right. So those findings might suggest a different heart problem altogether. The physical exam alone isn't a slam dunk then.
Not usually, no. Which really underlines how tricky diagnosis can be. You have to think about other things that can look similar.
The differential diagnosis, right?
Exactly. What else could it be? Feline asthma is a big one. Cardiomyopathy, like we just mentioned. Chylothorax, which is a specific fluid buildup in the chest.
Okay.
And even other lung parasites. Things like Elurostrongylus or Paragonomus, they can all cause respiratory signs.
No, so lots of possibilities to rule out. What about just standard blood tests? CBC, chemistry panel, do those help?
They can offer some clues, but again, nothing's really specific just for heartworm, and the findings change depending on the stage of the disease.
So variable results.
Very variable. You might see, say, a mild anemia, the kind where the body isn't making new red blood cells properly. Sometimes you see eosinophils, a type of white blood cell, go up. That often happens with parasites.
Okay, that makes sense.
But it's inconsistent. Actually, sometimes seeing an increase in a different white blood cell, the basophils, can be a bit more suspicious for heartworm. You might also see high protein levels, specifically globulins.
Might see. So hints, but not definitive proof.
Exactly. Little flags, maybe, but not a diagnosis on their own.
Which brings us to the specific heartworm tests. Let's talk microfilaria tests first. You said the larvae are rare in cats.
Right, so tests designed to find those microfilaria. They have really low sensitivity in cats, meaning they'll miss most infections.
I miss them.
Yeah. Now, if you do happen to find microfilaria on a test, it's highly specific. The cat's infected, but you're just very unlikely to find them.
So not a reliable screening tool for cats at all.
Not really, no.
Okay, what about the antigen tests? Those are the standard for dogs, aren't they?
They are. These tests, usually ELISA or similar types, look for proteins, antigens that are shed by adult female heartworms.
Adult female worms.
Yeah.
Okay.
Yeah, that's important. So if a cat's antigen test is positive, that's strong evidence they have adult worms. It's quite specific.
Good. So a positive is pretty clear.
It is, but, and there's a huge but for cats, false negatives are really common.
False negatives, meaning the cat has worms, but the test says no.
Exactly. This happens a lot if there's only a few worms, say fewer than 5 adult worms. Or if the infection is only male worms. Since the test mainly picks up female worm proteins, no females, maybe no positive test.
Ah, I see. So a negative antigen test absolutely does not mean the cat is clear.
Absolutely not. In fact, studies show over 40%, maybe even more, of cats with adult heartworm infections test negative on antigen tests.
Over 40%, that's a lot of misdiagnoses potential.
It is. And remember Harfard, the respiratory disease from immature worms?
Yeah.
Many of those cats are sick before any adult worms are even present to make an antigen test positive.
So the test wouldn't help with those early cases at all?
Not the antigen test, no. There is some newer research, though. suggesting that heat treating the blood sample before running the test might break up some interfering complexes and actually improve the sensitivity.
Heat treating the sample, that's interesting. A potential improvement down the line, maybe?
Possibly. Something labs are looking into. But for now, the takeaway is positive antigen test is significant. Negative antigen test tells you very little, unfortunately.
Okay. That leaves the antibody tests. How do they work?
Antibody tests work differently. They detect the cat's immune response, the antibodies that the cat makes against the heartworm proteins, and importantly, they react to proteins from both immature and adult worms.
Both stages. Okay. So are they better?
They are definitely the most sensitive tests we have. They're much more likely to pick up that a cat has been exposed or infected, even with low worm numbers, or those early immature stages that cause hard.
Most sensitive. That sounds good. But there's a catch, isn't there?
There is. A positive antibody test tells you the cat has been exposed to heartworm antigens at some point. It does not confirm there's an active, ongoing infection with adult worms right now.
Ah. So it could be a past infection the cat cleared?
Right.
Or maybe just exposure without worms fully developing.
Exactly. Antibodies can hang around in the system for a long time, even after the worms themselves are gone.
So positive means exposed, not necessarily currently infected with adults.
Precisely. The tests usually turn positive within about 4 months of the initial infection. Some research suggests a really strong positive antibody result might make an adult infection more likely, but it's not definitive.
Still not proof.
No. And just to make it even more complicated, sometimes a cat with adult worms might test negative on the antibody test too.
Oh.
If there's a lot of antigen and antibody binding together into complexes, it can kind of hide the antibodies from the test.
Wow. Okay, let's recap this testing because it's complex. Antigen positive, likely adult worms. Antigen negative means very little. Antibody positive means exposure, could be past or present, could be immature or adult. Antibody negative usually means no exposure, but could rarely be a false negative in an adult infection.
That's a pretty good summary, yeah. It highlights why diagnosis often involves putting multiple pieces together. You can't rely on just one test, like finding clues versus catching the culprit.
Right. It really sounds like detective work. So if the blood tests are this complicated, imaging must be pretty important. What about x-rays?
Radiography, chest x-rays, yes, very valuable. There's some classic signs vets look for. The main pulmonary artery, the big vessel leaving the heart for the lungs, might look enlarged.
How enlarged?
There's a rule of thumb, wider than about 1.6 times the width of the 9th rib on the x-ray image.
Okay, specific measurement.
Yeah. Also, the arteries branching out into the lungs might look sort of blunt-ended or tortuous, twisty, and you might see fuzzy patches, infiltrates, around those vessels. Sometimes fluid builds up in the chest cavity too. Pleural effusion.
Fluid. Okay.
And interestingly, that chylothorax condition we mentioned, the lymphatic fluid, that's been linked to heartworm infection in cats too.
So x-rays give you a look at the lung landscape and the big vessels. What about ultrasound of the heart, the echo?
Echocardiography, yeah, that can be really helpful too. You can also show that dilated main pulmonary artery, and sometimes you can actually see the worms.
See the worms on ultrasound? Seriously?
Yeah, especially with a good machine and an experienced operator. They often show up in the pulmonary artery, sometimes in the right side of the heart itself. They look like bright parallel white lines, kind of like an equal sign.
An equal sign, wow.
Finding that is pretty definitive. Plus, the echo is great for checking the heart muscle itself, ruling out those cardiomyopathies that can mimic the signs.
Okay, so echo is sensitive, especially in skilled hands, and can see the worms directly sometimes. It sounds like you often need a combination, then history, signs, blood tests, x-rays, maybe an echo.
Often, yes.
Yeah.
Putting all those puzzle pieces together to get the most likely picture, it's definitely not always straightforward.
Which leads us to the really tough part, treatment. Once you do diagnose a cat with heartworm, what can you actually do?
This is the most difficult conversation, honestly. Because the hard truth is, there is currently no approved medical therapy to kill adult heartworms in cats.
None. No shots like they give dogs.
No, the drugs used in dogs are not considered safe or effective for cats. It's a critical point. There's no simple cure injection.
Oh, sobering. So if a cat owner hears their cat has adult heartworms, the options are really limited.
Extremely limited in terms of getting rid of the worms directly with medicine. It makes prevention absolutely crucial, doesn't it?
It absolutely does. So what can be done? Are there any options at all?
Well, in very specific cases, usually at referral centers, surgical removal of the worms might be possible. either open chest surgery or sometimes using special catheters.
Surgery to pull the worms out.
Yeah, but it's complex, carries risks, and it's not suitable for every case. And a cat that's already sick usually needs to be stabilized with supportive care first.
Okay, so surgery is a maybe, but rare and specialized.
Right. Now, there is some thought, maybe even evidence, that cats might be more likely than dogs to spontaneously clear the infection on their own over time. Their immune system might eventually win.
Spontaneous cure. So the cat's body just gets rid of them sometimes.
It seems possible, maybe even more common than in dogs. But it's certainly not guaranteed, and a cat can still suffer significant disease while the worms are there, or even from the dying worms. So you can't just rely on that happening.
No, definitely not something to bank on.
Mm.
Okay, so if we can't easily kill the adult worms with medicine, what is the medical approach? Supportive care?
Exactly. For cats showing symptoms, the goal is stabilization and reducing inflammation. That often means things like oxygen therapy if they're struggling to breathe.
Okay.
Medications like theophylline can help open the airways. Prednisolone, a steroid, is really important to decrease that lung inflammation caused by the worms or the reaction to them.
Steroids to calm things down?
Yes, usually started at a higher dose and then tapered down slowly over weeks or months. And often, an antibiotic called doxycycline is used.
Antibiotic, why?
It targets bacteria called Wolbachia that actually live inside the heartworms. Getting rid of these bacteria seems to help reduce the inflammation when worms die and may even weaken the worms themselves.
Interesting. Targeting the bacteria within the worm.
Yeah. And sometimes careful fluid therapy if needed, but you have to be cautious not to overload them. But again, just to reiterate, no adulticide drugs like melarsamine, the dog treatment. That's not recommended for cats.
Right, no imidacide for cats. What about for that scary PTE, the lung clot?
The supportive care is basically the same. Oxygen, bronchodilators like theophylline, steroids like prednisolone, maybe doxycycline, trying to manage the consequences.
Okay. Are there things that definitely shouldn't be used, besides the dog treatment?
Yeah, aspirin used to be tried sometimes, but it hasn't really shown any benefit for feline heartworm, so generally not recommended.
Okay. So it really is about managing symptoms, reducing inflammation, and supporting the cat while hopefully its body deals with the worms over time.
That's the essence of it, yes.
So once a cat is diagnosed and is getting this supportive care, what's the follow-up like? How do you monitor them?
Careful monitoring is really key. It involves, regular vet checkups to assess how the cat's doing clinically. Are the breathing problems better? Is the coughing less?
Checking symptoms.
Exactly. And repeating chest x-rays periodically is important to see what's happening in the lungs. Are those changes getting better, worse, or staying the same?
Seeing if the inflammation is resolving.
Right. And repeating the heartworm antigen and antibody tests can also be part of it to track changes over time, although interpreting those changes can still be complex.
Okay, so ongoing assessment is vital. Which brings us, finally, to the most hopeful part. Prevention. How do we stop this from happening in the first place?
Thankfully, this part is much more straightforward. We have excellent, safe, and effective preventative medications for cats.
Good. What are they?
There are several options. Common ones include products containing ivermectin, milbemycin oxime, selamectin, or moxidectin.
Okay, those sound familiar from dog preventatives, too.
Many are the same active ingredients, yes, but formulated specifically for cats in the right doses. They come as monthly chewable tablets or topical liquids you put on the skin.
Monthly treatment?
Usually monthly, yes. Consistent year-round use is really the recommendation, especially if you live anywhere mosquitoes are present, which is pretty much everywhere these days to some extent.
Year-round, okay.
And here's a really crucial point we touched on earlier. Even if a cat tests positive on an antibody or antigen test, it is not a reason to stop giving preventatives.
Right, because the preventatives stop new infections.
Exactly. They kill the larval stages transmitted by mosquitoes before they can develop into adults or cause HARD. So you're preventing the problem from getting worse or happening again. Keeping that protection up is vital.
That makes perfect sense. Keep the new larvae out. And of course, thinking about lifestyle, like limiting outdoor access, reduces exposure too.
Definitely. Reducing mosquito bites is always helpful.
Well, this has been incredibly informative, a real deep dive into just how different feline heartworm is. It's clear it's a sneaky disease in cats, much harder to diagnose definitively.
Yeah, the testing is complex.
And with really limited options if an adult infection takes hold. Understanding those tests, antigen versus antibody, what positive and negative really mean, that seems absolutely critical.
It really is. For owners and vets alike.
And the overwhelming message that comes through, loud and clear, is prevention, prevention, prevention.
It's paramount. Truly the best approach for cats.
Given everything we've discussed, the diagnostic hoops, the lack of a simple cure, the potential for serious illness, even without adult worms, it really makes you think, doesn't it?
It does.
Especially for cat owners in areas where heartworm is common. What are the ethical considerations, about letting cats outdoors versus keeping them in, and the absolute necessity of being diligent with those monthly preventatives? It's definitely food for thought.
Absolutely. It brings the responsibility of prevention right to the forefront, considering the difficulties if infection occurs. Something for every cat owner listening to really consider.